Alberta patients, I've got some great news for you. The Alberta government is going to be copying a policy that countries with better performing universal healthcare systems use. Now, to understand what I'm talking about, consider this for a moment. Imagine you walk into a grocery store. Would you ever just give the store $300 and say, please give me lots of groceries?
What?
Of course, the answer is no. No one would ever do this because there's no accountability this way. But this is basically what happens pretty much across the country when it comes to healthcare. And the Alberta government is saying enough is enough. We're going to do what better performing universal healthcare systems do in other countries. And so what they're going to do is start giving hospitals money every time they actually help a patient. Yes, this is a novel concept in healthcare.
I wouldn't have thought so either, but here we are.
So, for example, they might figure out that, say, they're going to give a hospital $10,000 if they provide a knee operation to a patient. And then if another patient gets a knee operation, well, then the hospital gets another $10,000. So you can see how this incentivizes the hospital to help as many patients as possible because then they get more money. Now, the second really important thing that this does is it gets the hospital to focus expenses around things that actually help patients. Salaries for doctors and nurses, medical equipment, and so forth, rather than spending money on bureaucracy, more vice presidents, admin staff in hospitals and health regions, and so forth. Under this model, more money will be spent on activities that actually help patients. And so that's why so many other countries around the world use it. Sweden, France, Australia, there's lots of models, lots of different countries. We've talked to officials in these countries. It works quite well.
Norway and Sweden and Iceland and Finland and Germany now one piece. Switzerland, Austria, Czechoslovakia, Italy, Turkey and Greece.
But it's not just happening in other countries. Quebec has actually had some very good experience with this. They call it patient-based funding. Alberta's going to call it patient-focused funding. It's still basically the same idea. And in Quebec, they've been using this for several years. They've been using more and more services under this funding model. And what they've found are numerous examples where the cost per procedure is getting lower because there's less waste in the system. More money is being dedicated on services that help patients. And the other thing that's been happening, most importantly, is that output has been going up. So it's been helping to reduce their wait times for patients.
That's a win, 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 win.
So, in closing, let's all cross our fingers and hope this works out well in Alberta like it has worked around the world, because then even more provinces can copy this and help to reduce wait times for patients. I'm Colin Craig from secondstreet.org. Thanks for watching, and please don't forget to hit the subscribe button.